Okay, guys, I think we've got some good amount of participants in. Thank you so much for taking the time out. Hopefully, you've got some lunch and a cuppa just to sit back and listen to a special edition of the Decade of Data today. And before we start our webinar, I'd like to acknowledge the Wurundjeri people of the Kulin Nation, the traditional owners of the land we meet on, and pay our respects to elders past, present, and emerging. So we recognise the strength and resilience and wisdom of the First Nations people, and we dedicate our work to creating mentally healthy environments that positively impact people's mental health and wellbeing. So as I said, welcome everyone to today's special edition of Wellness by the Water Cooler. So what we're doing today, Ross, myself and Brianna, will recap our data presentation that we had in Melbourne on the 9th of October. And we'll just recap and focus on, our important discussion around workplace wellbeing and really starting to emphasise that power of legacy and data insights and collaboration and the future of mental health in the workplace. I'm Nat. So for those who haven't met me before, I'm the Chief Mental Health Advisor at SuperFriend. And it's my pleasure to introduce you to our fantastic panel. Joining us today, Associate Professor Ross Isles, our Chief Research Officer at SuperFriend, and Brianna Katanash, who's Allianz's National Manager for Mental Health Strategy and Delivery. We're having a giggle before. We've known each other all for quite a while, so it's nice to again be in the room, and I've always loved our camaraderie between the three of us. But look, let's start with a bit of a recap of the reason as to why we're all here today. And over a decade ago, SuperFriend really set out with a clear mission, which was to help workplaces thrive by promoting mental health and wellbeing, and really recognising that need for that national benchmark. We launched the Indicators of a Thriving Workplace survey. And this has since captured the voices of over 75,000 workers and essentially become a bit of a cornerstone of our efforts to measure and understand workplace mental health across Australia. So the insights that we've gathered over the past 10 years, it really reveals some progress. So definitely greater awareness around good mental health in the workplace and better wellbeing. We're seeing, that reduced stigma and also a growing commitment to improving mental health at work. But the challenges do remain, and this is evidenced by what Allianz is going to be bringing to the conversation within their visuals of the increased psychological injury claims. So to address these complexities, partnering with the likes of SuperFriend and Allianz and drawing both on that mixed methodology of data insights really allowed us as a team to build a sense of evidence-based recommendations that can shape the future of workplace mental health. And this is where we created our lovely presentation to mark the 10th anniversary of the survey. We can reflect on how far we've come, but also recognise the work that's still ahead. So the data shows improvement in areas like bullying and stigma, yet the mental health outcomes still suggest deeper issues. And that's why SuperFriend and Allianz continue to innovate and integrate data from multiple sources to really being able to deepen our understanding of those high-risk industries along with the job hazards that accompany them. So while awareness of mental health and mental well-being has grown, the challenge lies in translating that acknowledgement into real actionable insights that each industry can use. So let's chat about how our collective efforts, past and present, will drive meaningful change and build a thriving future for every Australian workplace. So Ross, I'll start with you. As a Chief Research Officer at SuperFriend, in the past couple of years, but as a decade long, you've really had that front row seat to see the evolution of workplace mental health. Now, could you share some insights with the listeners again of some of the most significant trends that have emerged from our ITW survey over this decade? And what do these trends tell us about where we've made progress and where we still need to focus on our efforts?
Yeah, thanks, Nat. I think to do that, we need to go right back, 10 years ago to when the Indicator of a Thriving Workplace survey started. And it was at that time when there wasn't actually a lot of research literature around in that space. And so where the the indicators of thriving workplace, or ITW. That's what I tend to refer to it quickly. So if anyone hears me rattle off ITW, that's what I'm referring to. Was really developed through a series of workshops with stakeholders. And if you, there'll be an opportunity to download the Decade of Data report afterwards. You can actually see we've contacted the person, Paul Vittles, who was the first person in terms of developing the survey. And way back 10 years ago, those stakeholder workshops, using the literature that was available and surveying just over 1,000 people, was where things started. And the whole idea was to be able to give us an idea of what are the benchmarks or what are the things that we need to be looking at in a workplace to really, get a picture of this workplace wellbeing, workplace mental health. What does it mean, and how can we actually track whether things are being effective or changing over time? And so that's 10 years ago. If we fast forward to now, like you mentioned, Nat, we've got over 75,000 people have filled out the survey. I believe it's about, most recently, we've ticked over the 77 mark. I'll get onto why we keep ticking over a little bit later. And in that 10-year period, we've learned a lot about what are the factors that are influencing mental health, and we've actually really improved how we communicate the findings as well. So we've developed what we refer to as domains of a thriving workplace. To start off with, there was 4. There's a few things were squished together. The data told us we needed to be able to separate some of them out, and then our most recent update has really been to cast an even wider net, and then use the data to tell us what are the best 5 ways to communicate the information. And that has led to some slight changes in terms of what our domains are. Most recently, we've been able to incorporate work design to be able to describe how important it is that people have some control and say over their work. And all of that information is summarised in that Decade of Data report. But in that time, we have seen a lot of change. We've gotten a lot better in terms of what it is that we measure, and added things as we've gone along. So we can identify things like burnout, psychological distress, alongside all the really important information we've been collecting right from day dot. And that enables us to then look back over the 10 years and actually see, well, there has been a lot of change, in this space. There's a lot more emphasis now on workplace mental health than there ever has been before. And we can actually look back at some of the trends. And I'm going to go through just a couple of them. And they're the positives, if you like, that we actually can measure almost or use as a proxy for the level of stigma in workplaces, is how open and how confident are people talking about their mental health in the workplace. And in the last 10 years, if we take the 10 years as a whole, we've actually seen a steady increase in terms of the proportion of people who are actually confident talking about their mental health in the workplace. They're not worried about the repercussions of doing so. That's if you take the data as a whole. But then if you actually look at it in a bit more detail and focusing on the last 2 or 3 years, it actually peaked in 2022. That was when we had the highest proportion of people actually comfortable talking about their mental health. And we think that's a little bit of a carryover from, my audio is breaking up apparently. I'll try and sit closer and hopefully that's not a problem. We think that's a carryover from COVID in terms of mental health was front and centre. How we brought that and how that was represented at work was really something that was on everybody's mind. And so it was, people were comfortable talking about it. The only challenge is that we have is since 2022 that we have actually seen a decrease in the proportion of people who are actually comfortable speaking about their mental health at work. And our most recent data point actually sits just above 50%. So we want to make sure we don't undo the good work when it comes to mental health and wellbeing in the workplace, in terms of making sure people are comfortable to raise any concerns that they have without repercussion. But the benefit of the last 10 years and the emphasis that's happened as well is that there's actually a greater level of support and services available in the workplace than there ever has been before. And that's fantastic news. It means that there's greater access to the supports. One of the things, again, we need to be thinking about if we're thinking about the future and not just admiring, what a great job we've done, is making sure that those services aren't just a set and forget approach. We know, and there are, I'm thinking in particular of a review done by CIRA, who is the health and safety regulator in New South Wales, that indicates that the level of utilisation of those services really does vary quite a lot. And one of the key things that people find difficult or that isn't happening is actually people being told exactly how do you go ahead and access those services. Maybe it was part of your induction when you're bombarded with lots of information when you first started your role. Oh, by the way, we have this thing over here. And if it's never mentioned again, well, it's not always front and centre. So there are some barriers to actually people accessing them. And we need to keep up the efforts to make sure people know that these services are available and that they're confidential and that they're beneficial. So that's the two positive stories, if you like. One of the I guess negative things that we've been measuring over the last 10 years is how often people experience negative events at work. So I'm thinking of bullying, violence, harassment, those really negative things that you can really sort of put a finger on to say, well, that's actually a real challenge to mental health in the workplace. And so we've actually, when we ask people to respond to when they've experienced episodes of bullying in the workplace, we actually see quite a clear downward trend, that the bullying is happening less frequently. And we go, well, that's great news, because when it comes to workers' compensation claims, bullying is one of the leading causes of people making a claim for workers' compensation in the workplace. So we've gone to the Safe Work Australia claims data, so Safe Work Australia gathers all the workers' compensation claims from different jurisdictions, and they make a portion of that data available on their website. And when we look at that data, we actually can see, well, the incidence of bullying is going down, but the claims due to mental health or mental stress are actually going in completely the opposite direction. They're steadily climbing. And that's a bit of a challenge, because we're thinking, well, if bullying is one of the main causes, and that's going down, then why are claims going in the other direction? And so we've been in touch with Safe Work Australia to say, well, can we actually get a little bit more detail in the data that you've presented there? And when we're able to do that and only compare claims that are directly attributed to bullying in the workplace, the trend is actually a little bit different. The trend is that the last few years, which is 2 or 3 years behind SuperFriend's data, is it's actually starting to tail off and almost starting to point in the same direction, or the same trend that we see in the SuperFriend data. And what we're really looking forward to is actually seeing, well, how far, or getting the latest data from Safe Work Australia, will that actually start to marry up? Will we actually see those two having a stronger relationship, given that the SuperFriend data suggests that Safe Work claims data should continue to go downwards? And this is where working with a wonderful partner like Allianz is really, really important, because it's actually access and being able to share the information sets that we have to look for those important relationships. So we're not waiting 3 years to see if this is, if this data holds or not. It's actually about establishing those relationships and working out what are the most important lead indicators that we can capture in the SuperFriend data, and how can that help not only people at work, but then also insurers like Allianz, who develop all the services and the supports for people who are unable to work for their mental health, and potentially get out ahead and get in front of the problem.
Yeah, thanks, Ross. That's it shows just the depth, I think, of data and just to what we're actually seeing, and just the importance of seeing that upward trend, and knowing that from the mental health perspective, and also from what we've done, again, even from a community perspective, on being able to try to enhance better workplaces for all. But Brianna, Allianz has been conducting this extensive research into mental health of Australian workers for years also, but particularly, shining that light again on workers' compensation claims and workforce analysis. Could you just walk us through and recap what we were talking last week about some of your key findings that Allianz has researchers found, and how they align with us, and even then contrast with what we've seen at SuperFriend over the last 10 years, and how do these insights essentially complement or open that question as to why? So we've identified that gap of mental health in the workplace.
Absolutely. And I think this is the really exciting thing about partnership and data sharing in this space, is the ability to kind of interrogate the experience of workplace mental health from so many different angles, because SuperFriend had this phenomenal data around psychosocial safety and sort of the activity that workplaces were undertaking. We have a lot of data around the lag effects of that activity. So we have some insights into what's happening with mental health claims, and we have a lot of sentiment data around how workers are feeling and how they're responding to different things that are happening in their workplace. And for us, it's been such an interesting activity to be able to overlay your psychosocial safety data with things that we know that have happened across different industries as sort of key initiatives, and then looking at what that means in terms of changing the dial on the experience of workplace distress and injuries. And I wish I could paint a really positive picture, because I think there has been a huge amount of activity that workplaces have undertaken. I think there's been a lot of investment in this space. I think there's been a lot of conversations. And I'm really excited to see that in most businesses, mental health and psychosocial safety is really getting a seat at the table in those board meetings and in executive meetings, and it's seen as a real priority. But what we're not seeing at this point in time is the translation of all of that activity and effort into reducing workers' compensation claims. And that is only a very small snapshot of how we should measure the effectiveness of those programs. But it's also an important one, because workers' comp claims are speaking to us about the people that are experiencing the most significant distress and impact in the workplace, and are then going on to need support, periods of time away from work, and that kind of compensable scheme as a result. And what we've seen at Allianz across our research, which isn't quite the 10 years that SuperFriend have done, we're about half a decade of data, but still not too bad, is that between 2019 and 2023 calendar years, there have been some real shifts in the experience of mental injuries in the workplace that are then becoming claims. And in our book, which represents over 108,000 Australian businesses, plus a range of government agencies and departments, so a really good cross-section of the Australian workforce, we've seen overall claim volumes for mental injuries increase quite significantly by a factor of 47.5% in that period of time. And that's a really tangible increase when it comes to other trends we're seeing in other types of injuries and claims. We also know that these claims are becoming increasingly complex, and that the harm that people are experiencing is causing greater barriers and greater challenges with returning them to work. As a result, we are seeing quite significant increases in the amount of time that people are taking away from workplace after they experience a mental injury. In fact, that's increased by over 30% in that same time period, and is now out to an average of 69 days per claim. And when we then overlay that with data from ISCCR that spoke to the fact that the longer someone's away from work, the less likely they become to ever return and to get back into really meaningful, productive work, it's really concerning, because we're out at those real far outlying numbers when we're looking at workplace injuries. We've also seen the costs of these injuries also significantly increase. And for us, what costs indicates is often level of need and complexity. So as costs go up, it tells us two key things. Number one, people are needing more time away from work and we're having to pay more in wages, but also that people are needing more supports and services. And so we're paying more in treatment, in some of those auxiliary support services that someone might need to assist them with day-to-day functioning. We're seeing more inpatient hospitalizations and really complex mental health needs. And those costs have also significantly increased around about that 35% mark as well. So while we know that workplaces are doing an awful lot to try and create these well and thriving environments, we're not necessarily seeing the direct correlation to claims. And that's what's been really interesting about looking at some of the activity from the SuperFriend end. A great example of this is SuperFriend have been able to show that workplaces have had some really meaningful reduction in the frequency of bullying and harassment experiences. And a lot less workers are aware of these experiences occurring in their workplace, and also are experiencing them at far lower rates themselves. Yet bullying and harassment, along with workplace stress, still accounts for about 78% of the claims in our book. So what we do know is that when these experiences are occurring, they are still creating significant, probably disproportionate harm to a range of other sorts of experiences in the workplace. And I think it's really important that we're able to create these comparisons, because what that tells me is that we've probably done a great job in reducing prevalence of maybe some of those lower level behaviours. So things like incivility, maybe ineffective performance management that then started to border on some of that bullying and harassment type behaviour. I think we've done a great job across workplaces in minimising some of those experiences. But when we are seeing experiences today, they are really consistently correlating with harm and distress to workers. So we need more work and more programs that actually manage some of that flow-on impact and continue to minimise these experiences. I think another great example when I looked at our 2 data sets was around the experience of workplace violence and aggression. Again, we know this has been hugely on the radar for the safety regulators across the country. We can see in the SuperFriend data that a lot of workplaces are doubling down in their efforts to manage these sorts of challenges, both in regard to prevention programs and trying to mitigate these incidences from happening. And we can see that the frequency of incidences has reduced. But again, when I then come in and look at the workers' compensation claims trends that Allianz can share, workplace violence and aggression claims are the fastest growing type of mental injury claim. Now, they're not the biggest cohort, but we have seen an increase in that kind of mechanism of injury of 76% over the last 5 years. So we know more and more and more people are being harmed by experiences of workplace violence and aggression. And again, I think it speaks volumes to the fact that we've probably done a lot to reduce incidents, but maybe there's a gap in the way that we're responding when an incident does occur that is now causing people that have had a level of exposure to be harmed or not to be supported in a way that drives early intervention and prevention of injury while we might be preventing incidents. And I think it's a really interesting conversation about that difference, because I think there is also a difference between preventing psychosocial hazards and incidents and then knowing how to respond when inevitably in some workplaces, industries, they do occur, so that these experiences are not harming and distressing workers when they do happen. And yeah, so that's where we've been really invested in this partnership. We're learning a heap. We're overlaying so much data, which I think is giving some phenomenal insights. And we're now really excited to keep working with SuperFriend and keep kind of hearing as well the voices of workers and workplaces so that we can understand what the data is telling us and then understand what we can all be doing to support.
It's so good, isn't it? Like to know the depth of the data from both of us, and it's already being able, like, that just not only the overlap, but coming at it from different angles. And, we don't really even, touch base on what we talk about with the clinical outcomes of our, how we measure distress at SuperFriend. And that's been a recent, looking at burnout and Kessler 10, anxiety and depression. But, you're really also highlighting the ripple effect, that this isn't just a workplace problem. It also then starts to expand out into the community with individuals having, the more likely that the more the days off, the less likely they are to get back to work. So what is actually the impact from a personal level on that? And so there's so many questions. And I think we did really well at honing it down, finding those 3 key themes, seeing that well-being paradox, dare we say, is that, yes, we've been doing so much more than ever, but it's more the injury to incidents kind of question that we really wanted to investigate. And I think this was where the power came from. And it took a phone call, didn't it, Brianna, that we had our beautiful usual, quick coffee or very caffeinated chats where we come to a quick solution together about, well, what next? What can we actually do to widen our understanding and lead by curiosity, and also lead with that interrogative voice is to me to go, well, we've got a little bit of the the what in front of us. We're starting to understand potentially the why, but then we need to go into the how, because we've got all these these resources. We've got our safety and the policies and procedures in place, but it's still not working. What's going on? And so this is, putting our hats on, really looking at how we can actually start to integrate conversation and wrap this over the two data points here. And so we named these little decade of data think tanks, and we structured these think tanks as that real collaborative workshop where participants across Melbourne and Sydney came together with really different representations across different industries, so we could gain a real diverse snapshot of what workplaces were feeling. And this has gone from the younger cohort, different types of orientation of representation to different roles from just employees to graduates to then up to leaders and then also to to CEO. So we had everyone in the mix to gain the collective voice there. It was also then just about creating a space to share those experiences and those insights, and it was really validating to bring in, I think Brianna and I are a psychologist by, dare I say, trade. And, I suppose from that psychological phenomenon of, when you bring people in, the excitement and the energy that they can actually bring to the table when people feel heard. So it really reinforced much of what our quantitative data had already shown, things like the critical importance of leadership commitment and the persistent gap between mental health awareness and then also just that practical application within the workplace. But what was even, as I said before, more valuable was those the new perspectives that surfaced around personal accountability and employee accountability, and also then that essential role of peer support to be able to build that level of safety or psychological safety, but also that awareness and then the what next. So it's really became clear that mental health just isn't a leadership or HR responsibility. It's a shared responsibility that everyone in the workplace, they really must contribute to. And so when we compared these insights from the think tanks with our quantitative data, it was clear that while we had those systemic issues that absolutely need to be addressed, there's also that growing need for real quantity or quality peer-led initiatives and grassroots support within the workplaces to start to create more of a client-centric theme. It's not just about the top-down policies anymore. It's about establishing environments where we can have our teams feel really empowered to support one another, but also to take accountability for their own well-being as well as that of their colleagues. We see this a lot through even our intergenerational differences there, where we've got, different levels of mental health literacy, but also different levels of autonomy and a growth mindset as well. So trying to really strike that balance. But that shift towards that shared responsibility where, we definitely heard was one of the key factors to really bridging the gap between awareness and actions, not to really put it all on one place. Ross, you mentioned before that we've seen this, especially within the EAP space, isn't it? Is that when we can onboard, here's your onboarding pack, here's the EAP to call for when you feel you need it. Okay, well then how do I determine when I feel I need it? And you know what, I need it now, but I can't find the pack and I'm too embarrassed to ask. So we've got all these blockers that we need to make sure that we're addressing within the workplace. But not only that, does that workplace and that EAP, for instance, is that appropriate to the way the workplace is being created or their level of work design? And this is to be able to bring everyone involved to ask how they would like their workplace resources and initiatives to be led, is that it will show that we will all work together. It's not just a leadership challenge or issue there. So overall, these think tanks, we had 41 participants. They were across 14 different organisations. So it gave us a really great snapshot and conversation that were around 3 hours per state. The takeaway was really clear, that despite the increased, awareness, that many workplaces still struggle to turn that awareness into sustainability, and that sustainability then into the meaningful action. So what we did at the team at SuperFriend is we transcribed that and we analysed it into themes. And again, we found that the findings or the conversations, they really aligned with our 5 domains of a thriving workplace. So this really gave us a lot more richness to what we're trying to say, again, and also affirmation into what the work that we're both, that we're doing at SuperFriend, and then also how that tied in with Allianz data. So again, that mixed methods approach just created that level of richness that everyone was not only heard, but it's again, still, we can get data points in different ways. So, on the leadership front, if we were to look at our 5 domains, a significant lead or need for the practical, compassionate leader. Brianna, can I just throw it back to you to talk about your work in compassionate leadership?
Yeah, this is something that we know really makes or breaks the experience of distress and harm in the workplace, and is one of the most influential factors on return to work outcomes and recovery outcomes. And what we saw in our research this year, that I think married very well with the SuperFriend research in this instance, was that 85% of managers feel like they are doing a really good job of showing up for their people and offering that emotionally intelligent, compassionate leadership. But that sentiment is only translating through to about 46% of the Australian workforce. Now, I don't believe it's a lack of care or intent on managers' part that is driving that empathy gap. I think it's that we're seeing a few key challenges, and I think this really speaks to some of these sort of key areas that SuperFriend have within their domains as well. First and foremost, if we look at leadership, I think the remit of leadership has become much broader than what it's previously been. And we are seeing workers wanting and expecting their workplace to have conversations around much more than just work, and to be able to intervene and support around personal conditions and personal experiences outside the workplace. And, you know, the SuperFriend research speaks volumes, as Ross said earlier, about the fact that the majority of employees today are actually really wanting and vocalizing those sorts of experiences in the workplace, but we're not always equipping leaders with the skills to be able to respond. The other thing that we found, and I think we heard really clearly echoed in the think tanks, where we had a variety of people with lived experience of mental health conditions, of disability, of caring, a whole range of different personal factors that do then interplay with how they turn up to and function at work, was that we heard really clearly from them that they feel supported to an extent where there is that level of similarity, and where their leader has confidence in their experience and is able to share in that experience. But as soon as it's something that's a little bit different, as soon as some of those diversity and inclusion and intersectionality factors come in, the quality of those conversations kind of deteriorates. And we probably also need to do some real work in the leadership space about helping broaden the kind of capability of leaders to engage with the diverse topics, to talk about and provide support for experiences they might not have themselves or they might not be as familiar with, but also to create some really clear boundaries around what is and isn't the role of leaders, because we certainly don't want leaders stepping into that role of a counsellor. We have, again, in the SuperFriend data, something like over 70% of workplaces making available to their people programs for support through EAP and other access points to treatment. And yet we still have quite low uptake of those sorts of programs. So we need leaders that can really empower and encourage people to use the resources that are at our fingertips. And when we overlay our data, I think really interestingly, 23% of the workforce respondents that we surveyed said that they hadn't even heard the EAP program that their workplace offers mentioned in the last 12 months. So, you know, it's again a really good indication of how there are these disconnects occurring between the intent of workplaces, the opportunities exist, and then how we're actually pulling that down and translating that through to individual workers. And I do believe the real linchpin in that is leaders, and is particularly those frontline leaders who we probably need to invest a little more in and really upskill around some of those soft people skills and those conversation skills and that empathetic leadership. But also we need to wrap those people with support as well, because they are not immune to all of the experiences that we are talking about. They're probably in some ways at greatest risk because they do have so many different demands and so many different compounding issues. And certainly putting them in positions where we are asking more of them and then not providing them with that support is going to be unhelpful for everyone in this equation as well. So I think it's dual. We need to better build capability of our leaders, because leadership is so essential, but we also need to better support those leaders themselves.
100%, isn't it? We're all got that human element, isn't it? No matter what hat you wear in a workplace, you've still got the human emotion. So, Ross?
No, I was just going to say there's two things that back up basically what Brianna's saying. So one of the things we do here at SuperFriend is we actually can help individual organisations apply our measures to their own organisation. And we have done that with a particular organisation, and going through in detail actually unearthed a particular group within that workplace that needed extra support, and it was the managers, that they were particularly stressed. And even their staff were saying, that they've got the best intentions, but they don't have the time to actually do what they need to. And the other point, and we were just talking about this at SuperFriend today, this is in our most recent data collection, we actually asked people if they'd actually disclosed whether they had a mental health condition in their workplace. And we look forward to giving people all the stats around it and that sort of thing in the future. But basically, the most important thing in the manager's response is that the person disclosing their mental health condition perceives that they're actually doing something, or at least supportive in how they respond. If they perceive that the response is tokenistic or nothing, or it's minimized, minimizes that there's no action, that their results or their domain scores, their outcomes are much worse. And we're talking about upskilling managers. It's actually it's not that we need to upskill managers to be at that counsellor level. It's not that at all. What the data says is it just needs to be able to be perceived from the person that they actually are supportive. They don't have to solve the problem. They don't have to suddenly come up with 5 different interventions to change how they work to around their the demands or the requirements of their mental health condition. If they can just demonstrate some support, some empathy, then the person will actually be much better off having disclosed their mental health condition than if they hadn't disclosed it in the first place, which is a really important message to get out there, is that when someone does come to you and if you're a manager and that they tell you they have these problems, you don't, the worst thing you can do is think that you're going to make it worse, and so I'm just going to say nothing. It's actually to go, oh, I'm sorry you're dealing with that. Let's have a think about, well, what can we do? How can we support you? Maybe we don't know the answers now. Maybe we need to go find services, or maybe we need to look up those, where is that EAP? Because we know we've got it, but we can't remember where. It's actually really important, but the actual intervention doesn't have to be that difficult. And there's been a complexity has been built around around mental health to some extent, when a lot of times simplicity is actually going to be the most effective approach.
And I think this is the beauty of combining our data sets, because it can start to give workplaces some real confidence. Because Ross, you've just spoken to the importance in an early intervention setting and in a disclosure setting of leaders being able to just respond with empathy and care and authenticity, essentially. So we know that works in terms of preventing distress and harm and from smaller issues becoming exacerbated in the workplace. But the Allianz data also tells us that the most influential factor on return to work is perceived support from a leader. And again, how when someone comes to their workplace and says, I've been harmed, I'm injured, I need some help, how their immediate leader responds to that conversation, which tells me that we don't need lots and lots of different training programs catering to different scenarios. We need some really core practical training for leaders that helps them respond to these kinds of disclosures with empathy, with authenticity, and then know how to refer on to those sort of further services. So to me, it says we don't need to overcomplicate this mental health space and this training space, exactly as you say, Ross. We need to teach people to recognize, respond, and refer. And that's a pretty manageable, pretty practical approach. And we now know that there's many, many training providers out there offering these sorts of services. But if we can give some guidance to workplaces around, well, these are the things you should be looking for out of training, because we know these are the things that tangibly improve experience of workplaces and build capability, it now starts to help guide where that spend goes and where that effort goes. Because as we kind of started this session discussing, we've seen an awful lot of effort. We've seen an awful lot of investment that isn't necessarily driving results. What I think we really need to do is double down on the data and the exploration of those interventions as to what does and doesn't work, to be able to kind of guide workplaces in their next stage of investment. Because I would hate to see workplaces stop investing in such an essential space because they're not getting the outcomes that they would like to see.
Yeah. But that's the element of wellbeing washing, isn't it, as well?
Yeah.
Just because you may have those initiatives, coming back to the workers and actually asking, what do they want? How do they feel? And also the leaders, just to, again, as you're saying, is that, that the whole area around the compassionate leadership, it's around self-awareness, that level of that growth mindset. That's the new area for workplace wellbeing, and especially depending upon, the generations and your own mental health literacy, being able to grasp that. But it may just not be that just that session or that webinar or that document. It's that continual feedback loop that can be so supportive. And again, EAPs to also play a major part in working together with workplaces and making that EAP, making sure that they're not a tick of the box, because they should be actually seeing the results. Again, our recent data has actually shown such it's still stagnant on the way that the EAP is being used within the workplace. After however many EAPs and how much the innovation has occurred, there's still that blockage there. So leadership and capability, kind of our domains, they really shined within the think tanks. I'm really mindful of time because it's us, we could talk all day, and if everyone had the rest of the afternoon off, unfortunately we don't either. Always please feel free to reach out to chatting about anything further. I'm just going to put the ability for you to download the Decade of Data report in the chat now. So please download and scan that QR code. But before we say goodbye, Ross, any key takeaways from our presentation and also working with the amazing people at Allianz?
The thing that struck me most when we first presented the Decade of Data report was how we were able to respond to the questions people had. When we had SuperFriend talking from the workplace measurement perspective and Brianna at Allianz talking about the workers' compensation perspective, how complementary putting those two data sources or perspectives even was really, really important in terms of, yes, not everything we see in the workplace is going to translate into a workers' compensation claim, but we need that shared perspective and thinking. And it really stood out to me. It was just like, okay, here's one perspective, here's the other perspective, and they overlap in the middle really nicely to help understand in a bit more depth exactly what's going on and potentially what we can do about it. So that for me was the main thing. The number one takeaway for me as presenting and getting this information out there is there's so much opportunity in working together and sharing information. We can get a better perspective on the problem, and then more input into what might be some solutions.
Yeah. I think for me it was that collaboration, that opportunity to paint the bigger picture. And when we overlaid that lived experience voice with the SuperFriend data, with the Allianz data, I got such a broader understanding than what I'd previously had. And I consider myself fairly au fait in this space, but I was suddenly like, oh yeah, this makes sense in a way that it hadn't to me previously. And so I'm really excited about the prospect of being able to continue to interlay more data sources into that. I think the idea of productivity data is really interesting, and how workplace productivity also feeds into this space in both a positive and a negative way. I think it's really important that we continue to look at kind of diversity data and make sure when we're pulling these sort of results, we're not just getting the common voice, but we're also capturing the voice of people with unique but important experiences. And so I think there's a big piece of work to be done in that space. And so I think my first takeaway was we have to continue to work together and really interrogate what we're currently doing, and do it in a data-led way that doesn't lose the voice of the individual worker within it. And I think we're on very much the road to doing that. And that then leads to my second takeaway, which is that while I still maintain that activity is better than nothing and workplaces should be doing what they can in this space, I also believe that as leaders within the industry, we're in a position where we really need to start better guiding employers around what good looks like and what tangible impacts they can expect from different interventions, different resources. If they're going to focus in on leadership, what should a leadership program look like? If they are really wanting to drive more connection, because we know that that's really essential for wellbeing, how do you create good avenues and outlets for connection within your workplace? And for me, that's the second step, is looking at that with an industry specific lens, because we know it is going to vary depending on people's occupation and their industry and their jobs. But also, rather than constantly re-innovating and throwing more and more new, I think there's a really fantastic opportunity with our data sets to look back at what's been done and give some really articulate insights around what has and hasn't had the impact we need. Because I think the mental health industry and workplace mental health has been moving so quickly with great need, and particularly driven through COVID, that we probably haven't had this moment of pause where we assess what is really working. And I think we're at that moment of time where we really do need to assess what's working, and then how does that shape what comes next to create the workplaces we all want to be a part of.
Absolutely. So I'm hearing bespoke psychological safety per industry. I'm hearing simplicity. I'm hearing pause and reflection, hearing collaboration, shared commitment, and then to be able to continually innovate as a team. Thank you so much. That was so good. I hope everyone got something out of it today. I've put some links in the chat. And please, again, just reach out to either Allianz and SuperFriend just to hear anything else. And again, what's on the horizon for us? There's many data points to learn and to investigate. And how we're going to do that is going to be our next step. Hopefully you can attend the next Wellness by the Water Cooler, which is on the 7th of November, where I'll be chatting with Greg Stark from Better Being about the role of compassionate colleagues in the workplace mental health. So what a lovely segue into what we've been talking about today to something that we heard a lot about, and through both of our data points. Going to be another great discussion, so hope to see you there. Thanks again, Brianna and Ross, for joining today, and take care, everyone that listened. Thank you.